came and said hello to me. Said, would I like some sweet honey?
Hi YouTube, it's Monica, and I just got back from my pre-op class and my pre-op testing. So let's get started because I've got a lot to go over. First, got there and had to fill out a questionnaire of how are you feeling today, and of course I had to mark that I'm going to the bathroom a lot, and everything else was fine. Then the nurse called me back, and they of course had to get a urine sample. I have a feeling that it's so much easier for guys to give a urine sample than women. But got through that, and then we drew blood. I only had to have 3 vials or 3 bottles drawn, and then after that was done, I went and had my EKGG or EGK or something to measure my heart. I'm not a nurse. I work in the business field. I don't work in the medical field. So pardon me if I don't get these names right. And they were just trying to check and make sure I didn't have any irregular heartbeat or if they could see anything. So, okay, got that done, and then waited in the lobby, waited with the rest of the pre-op class members, and we had some very good conversation out there. Everybody was talking about their surgery date and all different kinds of surgeries going on. There's several people with lap bands and gastric vertical sleeve and bypass, and we're all meeting together. So it was very, I had a lot of fun and enjoyed it a lot. So, alright, now what we did at the pre-op class, and as you can see, we got a whole bunch of stuff, like a packet and a notebook, patient guide, if you can see, patient guide, pre-op diet, that I'm actually on the pre-op diet, and a great big notebook full that's falling apart. And I also got a prescription for B12. It's a nasal spray, and you only do it once a week in the nose. So I guess it's a lot better than once a month shot and or any B12 under the tongue. So, but alright, let's go over the packet. The first thing we went over is the pre-op diet, which I've been going over that with you guys, and I'm pretty, some doctors don't require it, but Dr. Pennington requires it, and if he requires it, he requires it. So, the main thing that we went over was the vitamins for gastric bypass, because, as you know, they're the supplements that you have to do, and that's probably the most important, right? Let's see here. And of course, I've already got all these bought already, but I didn't get the doses down, and I realized that I'm going to have to eat like 6 chewables a day of calcium citrate to get my 1500 in, and also my multivitamin, which cannot be taken with, it can't be taken with anything. Let's see here, hold on. Yeah, separate iron and calcium by 2 hours. So I can't take them all at one time. Yeah, that one, I was shocked about that one, but I can understand. The doctor tells you to do it, right? Oh yeah, I forgot to tell you guys. Since my diet, or since I was weighed, I'm actually down 8 pounds. I'm down 8 pounds from last time I went and got measured, or weighed in from the last time. So, hey, 8 pounds on the pre-op diet, and I'm only on day 11. That's not bad. It's pretty nice. Like it. Okay. Well, they went over, make sure you get your 64 grams of protein in, and then we also went over how the hospital stay is going to be, and where to go, and what time to be there. I have to be there at 5 in the morning, so I think I'm the first procedure on Monday, and I was shocked. She said the procedure will only be an hour and 15 minutes. I figured it'd be at least 2 hours to do gastric bypass, and she said no. Nope. So, wow. That's nice. So, I'll be the first one in. Maybe be the first one out the next day. Of course, I'll be in the hospital overnight, and the goal is, of course, then went over the clear liquids and what you can have for the first 2 weeks until you start getting to normal, and not to drive for 4 or 5 days. I don't plan on it. So went over all that good stuff, and then I'll have to after the surgery, I have to go back for my 2-week checkup, and then another 2 weeks after that. And so, but that's basically what we went over, and so I was excited about the weight loss, which is, really good, because I felt like I had lost some weight, but I didn't really, know exactly how much I lost. So, yay, 8 pounds. It's not bad. It's a great start, and I have many more to go to lose. Let's see. But the next video I'm gonna do is probably gonna be while I'm at the hospital. Actually, no, I take that back. I'm gonna do another video on everything I've gotten and what I'm doing to prepare for my gastric bypass. I guess I'm gonna make a video of all my vitamin protein shake, and get all that together in my hospital bag that I'm taking to the hospital, what I need at the hospital. And so I'll do one video, and then the next video will be a video of me at the hospital, and hopefully my husband will do a good job videotaping. But we were told that he can't come to the holding room with me, so I won't get any of that on video, but hopefully we'll get some of the hospital stay. But alright guys, I will be making another video here shortly in the next couple of days. Bye.
It's yummy. I don't know where